So, to find out what's a patient that you would not want to perform vitreolysis on, I think the patient that you want to be wary of, first of all, is expectations. If someone tells you that they're not going to be happy at all if they have to do this again, if they want 100% perfection and they say, you have to remove all my floaters or I'm not going to be happy, I'll be wary of that kind of patient. I think managing expectations in any procedure we do is crucial. So I think, first of all, I would ask the patients to know what they're expecting from the laser and to explain to them that there might be multiple sessions again. Also a patient who physically cannot sit still in a slit lamp. Of course, it takes a little longer than a capsulotomy. It may take an extra couple minutes, up to 10 minutes, depending on how long it takes to visualize the floater and how many shots you need to do to remove that floater. So if a patient is going to be weary of sitting still in a slit lamp for more than a few minutes, someone who's scared of a laser, I would say would be wary of holding off on a procedure like this as well. And also, again, the floater. If the floater is in a location where you cannot see very well, if the patient doesn't dilate very well, you want to make sure that you preoperatively have a good understanding of where that floater is. And also if the floater is moving a lot. The more syneretic the vitreous is, the more watery the vitreous is, the more these floaters tend to change their location. So you may document in your office a certain location, and then when you're in the slit lamp and you're in the laser, you can't find it. So a lot of times it takes a while to actually find that floater. And so what I oftentimes will do to patients is before surgery, I'll say, where does the floater come from? Where do you see the floater? That will help me localize the floater. And then when I'm in the slit lamp, sometimes before I sit them down, I'll say, okay, now where do you see it right now? Because the location of where they're seeing it will help you guide, as a surgeon, where the floater should be when you visualize it in the slit lamp as well. But it's also important to understand that these floaters can move. And if you start to zap that floater, oftentimes if it's very syneretic, you may actually see the floater move. So you're chasing these floaters. So the more liquefied the vitreous is, the more wary you want to be, and the more you want to appreciate that it may take a little longer to find that floater.